So this Insta lecture is about the difference between tumor grading and tumor staging, which are often confused by many. Now, whenever we're trying to discuss about differences between two terms, I feel it is always wise to start with the similarities between the two terms. Now, both tumor grading and tumor staging, they are basically trying to figure it out how aggressive the tumor or cancer is. That is the basic aim and objective. But they are doing it through different ways, different methods. But the objective is to know that how aggressive the tumor is. That is the key idea behind this, doing this thing. And prognostify the tumor or cancer. Now I will start with first tumor grading. Tumor grading is entirely microscopic evaluation, and the key aspect of tumor grading is to figure it out that how well differentiated the tumor is. The term differentiated, I hope you have heard many times while reading medicine or pathology, like let's say well differentiated squamous cell carcinoma, poorly differentiated squamous cell carcinoma. What is actually meant by differentiation? So let me tell you a story to simplify this. So let me think that I with my brother went to a family gathering, and a person, my distant relative, comes to me and tells me that, Kishore, you exactly look like your father. And then he looks at my brother who is standing next to me and asks, who is he? And I tell him he's my brother. And then tell, okay, but your brother looks completely different from the parents. It's difficult to figure it out that he's your brother or he's the son of your parent, because his morphological appearance is quite different. Now, through this story, what I'm trying to tell you that actually in this case, I am well differentiated because I look like my parent, my father. But my brother is actually poorly differentiated. He does not look like my parent. So similarly, if a tumor look like its parent tissue in the biopsy, in the histology, it is called well differentiated. But if it does not appear like its parent tissue, it is called poorly differentiated. And grading, what we are trying to figure it out, that is this tumor well differentiated or poorly differentiated. If the tumor is well differentiated, the tumor's prognosis would be better. If the tumor is, and would be less aggressive. But if the tumor is poorly differentiated, it is usually would be more aggressive and its prognosis would be poorer. This is one of the essence, key aspect of doing tumor grading, which we are trying to look at, observe those tumor cells under the microscope. And tumor grading also looks at other things, like they also look at the nuclear feature, nuclear hyperchromasia, nuclear pleomorphism, and certain architectural patterns also. So these are the things also look at. But obviously one of the key things we look at is the degree of differentiation. Compared to that, there is another term is there, which is called tumor staging. Tumor staging is not done entirely under the microscope under the tumor grading. Basically, it is done by clinical evaluation, also radiologic methods, and also there is histopathologic evaluation can also be used for tumor staging. But it's not entirely under microscope evaluation. There are roles of radiology and clinical examination of the patient. They are the key actually in the staging. Now, staging, what we are trying to do, staging basically, we are also trying to figure out the aggressiveness of a tumor. But what we want to know that how big the tumor is and how far it has spread. These are the two things which we are trying to figure it out through tumor staging. And I hope you have heard the term TNM staging, which is usually used for solid cancer. T for tumor size, N for nodal involvement, how many nodes, how groups of nodes are involved, and M for blood-borne metastasis. So in a nutshell, tumor staging is about how big the tumor is, what extent they have spread, how far they have spread, and bigger the size is and more they have spread, obviously the prognosis will become poorer. So tumor staging, if you go to the higher stage, what usually happens, prognosis becomes poorer. The 5-year survival rate decreases. This is the essence of that. So in a nutshell, this is the difference between tumor grading and tumor staging. Thank you so much.